Okay. All right, any questions here? All right, gestational diabetes. Gestational diabetes. So it occurs in the later months of pregnancy, and this is caused by hormones secreted by the placenta. Hormones secreted by the placenta, okay, again we're talking about the expecting mother, that prevent the action of insulin. So your body is producing insulin, the mother's producing insulin. However, these hormones that are being secreted is preventing the action of the insulin on the glucose. The result here again is hyperglycemia. Hyperglycemia. Okay? So again, insulin resistant because your body's producing it, but your body's not acting upon the insulin. Hyperglycemia. Is gestational diabetes, can that be corrected?
Mm-hmm.
Yes.
It can be. Okay? So the mother, after she delivers, all she needs to do, they may even find this during the pregnancy, okay? And this is where it becomes very difficult because as you're pregnant, you basically want to eat whatever you want, right? So when they put you on a strict diet, it's difficult to do, okay? So hormones from the placenta help the baby develop, but these hormones can also block the actions of the mother's insulin to her body. This is also known as insulin resistance. So it can be corrected through diet, through exercise, but there's also been gestational diabetes where it's not reversible. But for the most part, it is reversible. Okay? Any questions? Okay? So basically with hyperglycemia, type 1, type 2, gestational, hyperglycemia, coma may be complication of type 2 diabetes. It may occur in the elderly with no known history of diabetes, mistakenly perceived as being inebriated. So if you have too much sugar in your body, sometimes it is shown as someone being inebriated. What's inebriated?
Drunk.
Drunk. Okay, so inebriated means drunk. Or having had a stroke. Or having had a stroke. Okay? So these two can be confused. There is a loss of effective insulin leading to diuresis. Again, diuresis is just excessive sweating. And the loss of fluid and electrolytes in your blood glucose level is often greater than 600 milligrams per deciliter. Over 600 milligrams. That's your normal range, guys. 80 to 115. 600, that's 6 times the amount. Okay? What happens with hyperglycemia is that you become dehydrated. Okay? Think about this for a moment. When you're hyperglycemic and you've got all that excess sugar or carbs in your body, what do you think is going to happen to your metabolism? Metabolism basically is just your core heat. Okay? Sometimes it's associated with the way you burn calories. Yes, it's how you burn calories. But all metabolism is your body temperature. Okay? So if you have excessive heat in your body, it's going to use up all your fluids.
Mm-hmm.
Yes, okay, so we have extreme dehydration. You may have dry skin, also sunken eyes. Okay? Remember what it said here, increased body heat. When you have increased body heat, it's dehydration. You're going to have low blood pressure, fast heart rate. Again, look how it relates. Extreme thirst. Okay. You may have some muscle twitching because, again, the lack of, not only are we removing your fluids from your body, but it's also depleting your electrolytes, which are found in your blood. Okay. If you're lacking electrolytes, you're going to have muscle twitching. You may have some difficulty speaking. You can have mental confusion, seizures. What's hemiparesis?
Not
Okay.
working one side.
Yeah, paralysis of one side. So you have paralysis of one side. And also may lead to coma. Yes?
Is there any chance that it could be higher than 600?
Oh, yeah. It can be, yeah. Definitely. If it's greater than 600, you need medical intervention immediately. Okay? Because remember, in its very worst state, it can cause coma. All right, so someone who becomes hyperglycemic, you're going to call for an emergency assistant. Again, do not leave the patient. Notify the physician in charge and be ready to assist. Take vitals every 5 minutes. Reassure the patient. You guys remember the pattern? Okay. How do we know if this patient's going through these different types of symptoms? How do we know that it is abnormal? What are we going to base it on?
Our baseline.
Your baselines, your Glasgow scale, your initial assessment of the patient. You know how your patient was when he initially came to you. If you have any of these sudden changes, again, I'm not going to figure out if it's shock or what. I'm not going to figure out if the patient's hyperglycemic or hypoglycemic. If there is a change in the level of consciousness and they're complaining of abnormal pains, difficulty breathing, what are you going to do? Stop what you're doing, get help. Be ready to assist. Take vitals every 5 minutes. Reassure the patient. Be ready to perform life-sustaining procedures if needed. Okay? Ketoacidosis. Ketoacidosis, or diabetic ketoacidosis, is a serious condition that can lead to diabetic coma or even death. So when your cells don't get the glucose they need for energy, your body begins to burn fat. Isn't that great? Isn't that great? I wish it was great. But then what happens here is burning fat, it's okay for a small period of time. But if your body continues to utilize fat for energy, your body produces ketones. Ketones are chemicals that the body creates when it breaks down fat to use for energy. The body does this when it doesn't have enough insulin to use glucose. Okay? When ketones build up in the blood, they make it more acidic. They make it more acidic. Okay? And then what happens to your body? Okay? Ketoacidosis is also serious. When someone becomes ketoacidosis, this can be life-threatening, and he needs to be treated immediately. Okay? So that's what ketoacidosis is. All right, any questions there? So the manifestations of ketoacidosis is weakness, drowsiness, headache, blurred vision, abdominal pain, nausea, and also vomiting. Because you have excessive sugar in your body, okay, remember it's utilizing fat, the insulin's not working, so it's not acting on the glucose levels. Your body starts to burn fat. You're still going to have an excessive amount of sugar in your circulatory system. You may end up with a sweet odor to your breath. Okay? It's going to smell sweet. Other thing here is what's known as orthostatic hypotension. What's orthostatic hypotension? Have you guys ever sat so long or laid down so long you got up and then you just did one of these? Woo.
Pins and needle. Yeah.
Okay? That's orthostatic hypertension. Okay? You're going to have warm, possibly dry skin. You're going to have a parched tongue. Remember what we talked about? This falls along the line of hyperglycemia. This is also hyperglycemia, but more specifically ketoacidosis. So you're going to be excessively dehydrated. So you're going to have a parched tongue, dry skin, dry mucous membranes, and then you're going to be extremely thirsty. When you have excessive sugar in your body, your metabolism goes up, your body temperature goes up. This is the cause of dehydration. Okay? You're going to have general weakness, lethargy, and fatigue. You may have a flushed face and you're going to have deep rapid respirations. Fast heart rate may lead to a coma. Okay. Diabetes is bad. Ketoacidosis is worse. It needs to be treated immediately. So again, we should know if our patient's diabetic when they walk into the room. Okay, it's going to be in their chart. How else are we going to know if they're diabetic?
Their ID tags.
Okay, there's going to be ID tags, but what are we going to do? We're going to ask them, are you diabetic? Okay, are you diabetic? Okay? So if they go into any type of these manifestations, stop, get help, be ready to assist, take vitals every 5 minutes, reassure the patient, do not leave them alone, be ready to perform life-sustaining procedures. Is this making sense, guys? Hypoglycemia. Hypoglycemia. This is the other spectrum. Other spectrum. Remember when I said that most of our patients, when they come in, they haven't eaten for a while. Okay? And when they haven't eaten for a while, they become hypoglycemic. And you need sugar for energy, right? So hypoglycemia occurs when diabetics have an excess amount of insulin. Okay, this is the opposite now. Now they're producing too much insulin. Because there's too much insulin, the other way that they're regulating their blood glucose supply is by now depleting it, because now there's just too much insulin. So now you're depleting your blood glucose. Okay? It can also occur when you've taken too much hypoglycemic drugs. Okay? This can also happen when you have inadequate food intake, such as our patients. Now, this can also happen to people who aren't diabetic, right? This also happens to people who are not diabetic when you don't eat. When you don't eat, let me see here. Okay, I'm gonna hold on off on my thought for a minute. Okay, so your blood glucose level falls below 50 to 60 milligrams per deciliter. Hypoglycemia may result. Again, this is your normal level, 100 milligrams per deciliter. We're now half the amount. So the onset and symptoms of hypoglycemia is also known as AKA insulin reaction, must be treated immediately because it interferes with the oxygen supply to the brain and may quickly lead to cerebral damage or death. Factors that precipitate this are acute illness, therapeutic procedures such as dialysis, and diagnostic procedures that require change in diet or being NPO. Okay, you're fasting for 12 hours. Okay, so it's some of the clinical manifestations. Number one is mild. When you haven't eaten, or if you're hypoglycemic, again, low blood sugar, don't you kind of shake a little bit? Okay? And then, don't you also complain of hunger? Okay, now think about this for a moment. When you haven't eaten, you guys ever heard the term hangry? Have you? It messes with your mood. It causes mood swings. Okay? So, it causes nervousness and irritability when you haven't eaten. Okay? Now, as it becomes worse, moderate reaction, you can become dizzy, you can have headaches and numbness of lips or tongue. There may be some confusion, there may be some profuse perspiration, and you can become cold, clammy, and also have blurred and double vision. Now, this is what happens to me. You guys just saw an episode of that when you haven't eaten or you're hypoglycemic. I can't think straight and my speech becomes slurred. Okay? When that happens and you see that happens, throw me a Snickers. Okay?
Become Betty White.
I'm going to tell you, I don't eat throughout the day, and it's a bad habit of mine. In the mornings, I usually have a cup of coffee. I don't have myself a good breakfast, and I also have a tendency to work through my lunch because I teach through, all day. I usually have a break, right after class, and then I start my next class around 1 o'clock. But I get so caught up in my office work, I forget to eat. So by the time I start my 1 o'clock class, I don't even know where I am. Okay? So what I do is I always keep a stash of mini chocolate bars, some granola bars, some suckers, some other sweets. Okay, but I don't have real food in my cabinets. It's usually just sugar. Okay. All right. Severe reaction. You become disoriented. You're going to have difficulty arousing from sleep. Impaired motor function, diminishing level of consciousness, seizure, and rapid lapse into a coma. So if the patient is conscious and complains of symptoms and says he is diabetic and has not eaten and is shaky, you're going to notify the MD and get sugar ASAP. Now, as technologists, you should have access to orange juice, apple juice, Tic Tacs, certs. You guys know where I'm going with this?
Oh, sure.
All have sugar, so in case your patient was going to a hypoglycemic reaction, you can easily remedy that. Okay?
Excuse me.
Yes.
So this hypoglycemia includes both sides of diabetes, but the hyper one just for the type 2?
Hyper is for, yes, for type 1 and type 2, they're hyperglycemic. So all that we're talking about here is either your body stops producing insulin or it's not responding to insulin. Okay, and then ketoacidosis is a response to type 1 acidosis, not type 2. Type 1 diabetes, not type 2 diabetes. You can get ketoacidosis.
Type 1?
Type 1. Okay? So again, when we're talking about 1, 2, and gestational diabetes, the result is hyperglycemia. So your body is either not responding to insulin or it isn't producing insulin anymore. Here, with hypoglycemia, it's basically you didn't eat or your body's producing too much insulin. Okay? Producing too much insulin. So now it decreases your blood sugar levels. Okay? So again, if someone is experiencing hypoglycemia, be ready to give some patients some remedy here. Carry some certs, carry some Tic Tacs. Know where the sugar packets are in your department. There should also be a fridge where you have access to small cartons of orange juice or even apple juice. Okay? So again, if there is nothing else available, use sugar packets from the cafeteria. If the patient has glucose tablets with them, give that to them. If the patient complains of diabetic problems, check their chart or check for diabetic race that identifies them as being diabetic. Now, if the patient has difficulty swallowing, the best remedy for this is that, let's just say you have certs or sugar or something that's dissolvable. You not only give it in their mouth, but you want to place those things underneath their tongue. Underneath your tongue, it is highly vascular so that it gets absorbed quickly and goes through your bloodstream very, very fast. Okay? So if you have sugar, certs, Tic Tacs, or whatever, place it underneath their tongue. It gets absorbed much faster. Okay? All right, so again, it kind of goes through the same thing. You may also have glucagon readily available in your department where they can just give an intramuscular injection into the patient. Okay? All right, don't leave your patient alone. Get help, be ready to assist, take vitals every 5 minutes, so on and so forth. Yes?
So since they've been fasting, giving them orange juice or lifesavers or something like that won't affect their scans because it isn't solid food, correct?
Say that again?
So say they start having shakes and stuff, give
Uh-huh.
them orange juice or Tic Tac,
Right.
and they've been fasting. That still won't affect their
study?
Yeah.
It will.
Okay.
It will. But at this point, it's like, okay,
They-
getting the image is secondary,
Yeah.
saving the life is primary.
Got it.
Yeah. So the question was, if we give them these things, if we give them orange juice or apple juice, is it going to affect the study? Well, it may, because now you have,
Cloudy.
yeah, it's not only that, but it's going to dilute the contrast that we put in the patient's body, so it can affect it pretty much. But again, that becomes secondary. Because what we want to do is we want to make sure the patient's okay. So we're going to make sure they're okay first and then proceed with the study. And it may be influenced by what they ingested a little bit, but it's okay. It's going to compromise it a little bit, but that's okay. Okay. Lastly, here is iodine reaction. We've already talked about anaphylactic reaction. But how does it lead to anaphylactic reaction? Well, for us in our department, it begins with an iodine reaction, which leads to anaphylactic reaction. Okay? So it is an allergic reaction to iodine. So contrast agents are categorized as drugs. Remember that. Iodine or contrast agents are categorized as drugs because they can be absorbed into the systemic circulation and may cause physiological changes. Most drugs that are administered intravascularly means that they are isotonic. So the drugs and medications that we usually put on the IV or through injection are isotonic, which means that they have the same thickness, consistency, viscosity as blood. Okay? They have the same thickness, consistency, viscosity as blood. Isotonic, near equal. Okay, they're nearly equal. All right, am I making sense so far? All right. With contrast agents, they have higher osmolalities, which means that they are thicker, more viscous. They're thicker, more viscous, and more dense than blood itself. Okay? So, let me go ahead and do another drawing for you. All right. So let's just say, for example, here is your vein, and in your vein, you've got blood, right? And then around here, around your vessels, you're going to have your different cells. You've got the tissues and organs containing all these different cells. Okay? Your body is always in a state of equilibrium, which means there's equal pressures throughout your body. It maintains an equal state of pressure throughout your body. Your body's always equilibrated. It's always equal. You guys follow that so far? Now, when you introduce contrast, which is thicker, more viscous, more concentrated, this is what's going to happen. Let's say we have contrast in here. It's thicker, it's more viscous. To get it back to equilibrium, we need to dilute it to get it back into the isotonic stage. Naturally, what's going to happen is your body, especially now your veins that have the contrast in it, is going to pull fluids from the surrounding cells and bring them into the circulatory system until your vessels are back into an equal state. Does that make sense? All right. This physiological change causes an adverse response. That sudden shift of fluids from the surrounding tissues and into your vessels is what causes this adverse reaction. So the sudden shift causes an adverse reaction. Okay? Because of this sudden shift, what's happening systemically? This is going to be a cascade of things to happen. Because of the sudden shift of fluids from the interstitial spaces,
They get shocked.
and the lack of fluids that your body's receiving, it leads to anaphylactic shock. Okay? Now what's going to happen is there's going to be release of histamines and bradykinins. The response is increased respiration, increased heart rate, decrease in what? Blood pressure. Okay, and decrease in urine output. This reaction is now going to cause your vessels to vasodilate, your blood pressure to drop. Because your heart's not beating as hard and your vessels are wide open, what's going to happen to your blood supply?
It's going to pool.
They start to pool. So the blood isn't returned back into your heart for redistribution. Okay? So this is what an iodine reaction is. So an iodine reaction, not only is your body releasing histamines and bradykinins, now it's also stealing fluids from the surrounding tissues and organs. Okay?
Did you just say you do kind of add to it to thin it out and make it more viscous? Or?
We're not adding to it. Your body is what's doing it. Because now you've got the contrast that you introduce to your vessels is going to be a lot thicker.
Mm-hmm.
To try to put it back in the state of equilibrium, it starts pulling fluids from the surrounding cells to bring the vessel back into an isotonic state.
This is just a random question, but is there any way to add something to the iodine to make it more similar to the consistency of blood?
Yes and no, and we'll talk about that later.
Okay.
Yes and no. So she's asking if there's anything that we can add to the contrast agent to make it less viscous. The answer is yes, there is, but we'll talk about that later.
So the reaction,
Yes.
reaction is pulling fluid from the cells around it, and that's
right.
that.
So an anaphylactic reaction, an anaphylactic response, firstly, is that with an iodine reaction, okay, when you have an allergic reaction, this is an allergic reaction to iodine, okay, your body's going to start releasing histamines as well as bradykinins. That reaction causes a response to these soft, smooth muscle tissues in your respiratory tract as well as your GI system. Now, what's going to happen here is the sudden shift of stealing fluids from its surrounding tissues. It's now, what it's doing here is stealing away from the other cells, which now is going to cause a trickle effect, which will cause the blood pressure to drop as well as causing the vessels to vasodilate. So that's the other response. Okay, and as we know, when that happens, that leads back to anaphylactic shock. Okay, an iodine reaction is just basically a subcategory of anaphylactic shock. Okay, so here are some of the reactions of iodine. First of all, before I talk about, we've already talked about the clinical manifestations. We talked about mild, severe, and moderate. What we didn't talk about here is what's known as a transient response. A transient response. Okay? An allergic reaction or an allergic response is unwarranted. We don't want that. However, a transient response is what we do expect. This is expected, this is normal. And when we inject contrast into our patients' veins or arteries, well, naturally what you're going to feel is a warm feeling throughout their body. A warm feeling throughout their body. This usually happens with a bolus injection. Okay? There are two types of injections. You have infusion and you have bolus. Infusion is just essentially delivering the contrast very slowly, very moderately. Whereas a bolus injection is very strong, rapid, abrupt. And we're talking about large amounts of contrast, like, let's just say this. Let's talk about this being 120 cc's of contrast. We have an automatic injector that will push that contrast into the patient's vein in less than 1 second. whoosh, that's a bolus injection. Okay? Transient response not only does include a warm flush feeling throughout your body, but you may also feel nauseous or vomiting. Okay? If it persists, it's an issue. If it goes away, that's normal. Okay? So if they feel nauseous and they feel like they're going to vomit, it should go away immediately. That's why we're always asking questions. How are you feeling? How are you feeling? How are you feeling? How are you feeling? If they continue to say, I still feel nauseous, okay, red flag. If it goes away, that's a transient response. This is normal.